Good afternoon, everyone, and I would like to thank all the media people present over here. And I would like to call upon Dr. Girish Karnad to take over the dais. I'm Preeti. I'm a senior audiologist working with Rajan Speech and Hearing Center. We would like to thank you all for joining us on the occasion of Rajan's launch of infant hearing screening program. Before we go on to the details of the infant hearing screening program, let me give a short introduction of Rajan Speech and Hearing Center. Rajan's was started in the year 1994 by Krishna Kumar. In 1994, there were only a few speech and hearing centers. Rajan's was the first center to introduce a scientifically designed protocol for consulting clients. We were the first to launch the in the canal and completely in the canal hearing aids in 1995, and we launched the first online hearing test program in 2001. In 2004, we launched the hearing helpline for the speech and hearing impaired and also conducted free camps for the police department personnel. And today we are happy to launch the infant hearing screening program by Dr. Girish Karnad, who is our honorable guest. And of course, Dr. Girish Karnad needs no introduction. However, let me tell you a few words about him. Dr. Girish Karnad is a contemporary writer, screenwriter, actor, and movie director. He is the recipient of Gnanapith Award, the highest literary honor conferred in India. And he is traveling later this week to receive yet another award, this time an honorary doctorate. And now I call upon Ms. Priyanka to present a bouquet to our honored guest for the day. Thank you, sir. And now I request Ms. Jayanti, our Director of Speech Services, to give us a small presentation on infant hearing screening program.
Good afternoon to everyone. I am Jayanti. I head Speech Department and Infant Hearing Screening Program at Rajan's. I have a short presentation on Infant Hearing Screening Program. Studies done have shown hearing loss is the most common defect with an incidence rate of 3 for 1,000 babies born every year. Every year, more than 4,000 babies are born with hearing loss. We are looking at huge number year after year. So, what can we do as a society do about it? This is exactly where infant hearing screening program helps. Why we need to do infant hearing screening program? Why is it important? Babies can't tell if they can hear or not. Hearing loss is a hidden disability. Babies who do not hear your voice, a lullaby or a nursery rhyme may have problems learning to talk. Ideally speaking, newborn babies have to be tested even before the mother is discharged from the hospital. If for some reason it is not possible, then it is advisable to be tested within first 2 weeks after birth. What is the present scenario? Generally, parents come to us at around 3 to 4 years of age with the problem of delayed speech and language. When hearing test is done, we see there is a hearing loss in children of varying degrees. And it is going to take 2 more years for the child to be rehabilitated because parents go into a denial phase. What are the causes for hearing loss? So here we have few causes for the hearing loss. It could be the family history, asphyxia, birth weight less than 1,500 grams, jaundice, ototoxic drugs, bacterial meningitis, rubella. These are the few most common causes for the child to have hearing problem. What is the advantages of early identification? Why early identification is very important? The first few years of life is critical to the development of normal speech and language. It is recommended that all the newborns be screened for the hearing loss by 1 month of age, have diagnostic hearing test to ascertain the degree and the type of hearing loss by 3 months, and enroll in the intervention program by 6 months of age. This is known as 1-3-6 protocol, and this protocol has been followed in the Western countries. By starting early intervention, we can achieve near normal speech and language development. I want to show you how hearing loss can affect speech pattern and voice quality in an individual. Can you please get Joshi here? He is Mr. Joshi. He is 35 years. He has got bilateral severe to profound hearing loss. His hearing loss was not detected at an early age, and due to which the intervention was also delayed. Say hello to everyone. Say hello to them. What is your name? Your name. Tell your name.
Chachi.
Okay. Your father's name?
Chachi.
So you can see how is his speech pattern and the voice quality. Okay, he has got severe to profound loss in both the ears, and his hearing loss was detected very late, and the intervention was also late, and sometimes he doesn't use his hearing aid also. Thank you. He works in our office as a technician. His real life situation is a struggle even for his daily activities. So it's very difficult. So now you will know if hearing loss is detected very late, then you have problem in speech also. Newborn hearing screening is a simple method of checking if a baby's hearing is intact. It is simple, safe procedure. How will a baby's hearing test be done? We evaluate a baby's hearing through the following test. BOA, it is Behavioral Observation Audiometry. This is done from 0 to 2 years of age. When sound stimulus is given, we see the response of the child, the different behaviors that the child gives us. The next one is OAE. It is called as Autoacoustic Emission. The third one is BERA. It is Brainstem Evoked Response Audiometry. OAE, it's a screening test, and it takes hardly 2 to 20 minutes, and the results are immediate, and this is done in a soundproof room. The results that we obtain is either a pass or refer. If we have refer report, we would repeat the test after 3 weeks. Still a refer is got, then BERA is advised. BERA is a diagnostic and a confirmatory test. At Rajan's, we specialize in evaluating infants, young children, and those children with special needs. Once the hearing loss is confirmed, intervention program should be planned at the earliest with the involvement of audiologist and speech therapist. Some of the intervention process used currently are digital hearing aids and cochlear implants, along with speech therapy and audiometry. I, practicing speech therapist, give importance for early identification and early intervention in infants. Thank you.
And now I call upon Dr. Girish Karnad to speak on the subject and launch this program.